Hey everyone, my name is Vincent Uy. You can call me Vince. I'm currently a third year medical student on rotations, and I've actually collected 2 years worth of different footages and experiences that I've had at William Carey, and I'd like to share that with you all. And the reason is because I've actually did some researching on my own on YouTube, and I haven't really found a culmination of a YouTube video that actually showcases the different resources and the services that we have here. So to put everything into a video, I believe that would be really helpful for incoming students. I wanted to make this video. And if you haven't really seen my YouTube channel, it's basically a culmination of all of my experiences and where I've been to. For example, I was previously an engineer officer, and I made a specific video for that training. And I hope this medical school training video, as well as day in the life, can help a lot of people. Most of this video will consist of voiceovers of me narrating the various experiences as a William Carey medical student. In addition, there's also a bonus part where I included a mock patient examination that you can refer to. However, if you're short on time, please feel free to skip it. The main purpose of me making this video is to introduce everyone to the amenities and resources we have on campus, the sites that you can check out, and the resources that you have access to. The video says a day in a life, but it's actually a culmination of all the recordings and footages that I've taken from the past 2 years mashed into a single video. So I'm going to do my best to introduce you to the services on campus. First, we have the Wilkes Dining Hall. This is by MMI Dining. They have a takeout service where you can just swipe your card and take out your lunch from there, or you can dine inside. They have a great seating area on both sides, and as you can see, a lot of faculty and students can come to this area. They have a variety of foods from both sides, ranging from salad to fast food. And on the other hand, you also have great desserts, such as the ice cream bar. Here we have another place to get food at the King Student Center. It's called the Carey Diner. They have a great selection of burgers and fries. In addition to the food services on campus, we also have the MedStudentLife Hall. Usually undergrads or graduate students can also live on campus. This is the picture of the Futural and Davis halls. A lot of the halls are structured similarly, and you also have a choice to live off campus. On-campus services are easier to access, and so a lot of the students like to do this. Here's a room layout of what the dorm looks like. For those who are medical students, you also have the option to live in the Penton House or the townhouses. The townhouses for William Carey medical students, also known as the Fordham Place, has about 3 bedrooms per house. You have your own bathroom, there's a living room, there's washer, and there's also a kitchen. Now that we talked about the residence life and campus dining at the William Carey University, I'd like to open up the discussion to the buildings you have access to as a medical student. These are the buildings that you will go to for your classes, trainings, labs, and more. The first buildings that you see here are the COM buildings. COM 3 is where the anatomy lab is, as well as where your OSCEs and patient encounters may be done. A lot of the opportunities on campus are found and not given, and so if you have an interest in anatomy or any other research fields, feel free to reach out to the professor, and they might assign you a project, or you can create your own. We have a Hero Innovation Lab that was utilized. This is the student lobby that is located in COM 3. And there are also study spaces on the side as well as outdoors. You can find scattered OMM tables nearby for you to practice. The student breakout rooms are located in COM 3. These breakout rooms can be used for interviews and testing. These are the clinical simulation rooms and clinic rooms that you can utilize for your OSCEs, for clinical encounter practices. This is the scrub station. We've got the student lobby here. This is right inside of Com 1. There are plenty of study spaces that you can utilize. This is the OPP lab that was seen back in Com 1. You can practice for your CSAs here. This is the research lab that is also located in Com 1. The admin lobby is located in Com 2. Above the second floor is where the faculty offices are. Right by the Com buildings, we have the Thomas building. This is where the sim rooms are located. You also have clinic rooms that you can use for practice, as well as the OPP lab in Thomas. Besides the Com buildings, the other main building that we utilize is called the College of Health Sciences. In the College of Health Sciences, we have the lecture hall, both for the first and second years. Now here we have something extra special. This is a building called the Institute of Primary Care. This building just opened up recently in fall of 2025. And most of the students, class of 2027 and below, have not seen this yet. So those who are incoming, you guys have the treat. Y'all will have a massive OPP practice space on the first floor that can hold basically your entire class in the same room, practicing OPP, so that you wouldn't have to be split up in 2 different sessions. On the second floor, there are plenty of sim rooms and clinic rooms, as well as a wide patio space on the outside to get some fresh air. It gives you a full view of Fales Asbury, the gym, as well as the entrance of William Carey and to the campus. The third floor consists of a large conference room with many seating areas, and it really looks like the first floor of the King Center, but now our own Com has a massive space for us to host events, and an admin suite on the other corner that has a sweet view to Fales Asbury. It also has a lot of good chairs. This is probably my favorite room out of the entire IPC. And the cool thing is that the Institute of Primary Care also connects directly to Com 1. And in between these 2 buildings, there are lots of sofas and study spaces that you can utilize as well during the connection. With that being said, medical students always want more study spaces. So what if the Com 1 and IPC are crowded? Where else can you go to not feel distracted? Well, we have the on-campus library. This library is somewhere that I usually go to. A lot of the times there are no students around, and it's a quiet place to just relax and study on your own, or grab a couple of friends and go into the study rooms. There are also lots of books that you can borrow from, including the first aid. Now, if you're tired of studying, you can head outdoors to the fields. Outside of Fales Asbury, there are multiple tennis courts if you like to play tennis, a soccer field if you like to play soccer, and a running area for those who like to work out and jog. On the other side, we have the softball and baseball fields, respectively, for the sports teams. William Carey provides a main gym for both the undergrad and graduate students. You can use this with your student ID. It has all the basic equipment, including weights and treadmills. You can bench, squat, deadlift, do some abs. There is a cool down exercise room that I like to utilize a lot. There's lots of yoga mats here, an ab machine for some sit-ups, lots of stretch exercise that you can do here, jump ropes, little dumbbells, also a boxing bag that you can use to de-stress. This is probably my favorite activity in the entire gym. I use it a lot We also got one in the Fails Asbury mini gym. This is specifically for our medical students. In the next few minutes, I'll be sharing a few of my academic experiences and works that I've personally been through during the first 2 years as a Carey medical student before rotations.
Do you think an average person who does not have insurance is
to other people and listen to their perspective? And that's where the whole...
Okay, do you have a mouse with a wheel on it? Would you zoom out, please? You all see, remember anaconda bone formation from the last scope side? Yeah, this is anaconda bone formation. We are starting to have marrow in sections.
In between weeks of lecture and exams, we also do plenty of labs, clinical training, including blood draws, the use of mannequins and simulators. We experiment with different heart and lung sounds, pelvic and rectal models, and plenty of sim training on mannequins to simulate emergency scenarios. Our program also gives us the opportunity to obtain an ultrasound certification, and here you see me using Butterfly to capture ultrasound products. In between classes, I've also undertaken a VR research project that is based on orbital anatomy. We compare different visualization methods and look at pre-post score differences in participant data.
Pretty cool, huh?
Yeah, that's really cool.
And same thing here. Repositioning. Some really good mind.
Okay, so I'll be starting with the Weber's test, putting this on your forehead. Let me know if it deviates to one side, or you can share it on both sides. So it's equal. Okay, I'm gonna put this on your master weight process right over here. Let me know when you can stop hearing it.
Yep.
Okay, I'm gonna put it by your ear. Can you hear this?
Yep.
Alright, I'm going to the other side, doing the same thing. Next, I'm gonna go ahead and check for his nose. So I'll put the speculum on, look at the top of your nose, looking for any lesions, any bumps, any trauma that you can see, and then go ahead and face up for me. Okay, I'm gonna pull on your nose. I'm gonna just go inside, looking at your nares first on both sides. I'm gonna look inside your septum, and I'm gonna look inside your turbinates as well. For the mouth exam, I'm gonna go ahead and just look at your lips first. Looking at his external lips, looking at his mucosa, and say ah for me. Looking at the superior top of your tongue, looking at the inferior part, and then looking at your gingiva and your dentition for any cavities I can find, and your oral mucosa in the back. And can you stick out your tongue for me? Okay, just seeing the hypoglossal cranial nerve 12, seeing if it deviates on any side, and then just yawn for me and stick out your tongue even more. Okay, I'm gonna observe his uvula in the back. It's in the middle, the cranial nerve 10. And I'm gonna look at this hard palate and soft palate, his tonsils. It's on his skin right here. Feeling for the roughness, his moisture, and the temperature on both sides. Okay, I want to do his turgor test. So returning back to normal on both sides. I'm just expecting his hands, looking at his folds, between his fingers. And then I'm gonna look at your nails too, looking at both sides. For any perinychia, you're looking at your nail plate, your free edge of your nails, looking at your lunula on both sides for any perinychia or clubbing. I'm gonna test your capillary refill. And it returns back to normal. Okay, now I'm gonna go ahead and check your eyes for you, okay? So the first test I'll be performing is a peripheral vision test. So about right here, you're just gonna go ahead and tell me how many fingers I'm holding up, okay? So cover your right eye, please. I'm gonna cover my left, okay? So let me know how many.
5,
Okay.
2,
Alright.
3,
Okay.
1,
Alright, great. And then switch eyes.
5,
Okay.
1,
Alright.
3,
Alright.
1.
Okay. I'm gonna go closer, and this is checking for external ocular motor. This is for cranial nerves 3, 4, 6. If you just pay attention to that finger, please. Okay, checking his eye movements. And then this is checking for his nystagmus to see if his eyes deviate right or left, okay? And then I'm gonna go ahead and look at your eyes for any ptosis, cranial nerve 3, any drooping of the eyes that I can see, and then I'm going to use a reflected light to look at his eyes to see any strabismus or misalignment of the eyes. Okay, I'm going to go in and then kind of tuck your eyelids down, looking at your conjunctiva, looking at the sclera, looking at your iris for any hemorrhage, lesions, and then looking inside your cornea. Okay, I'm going to take my ophthalmoscope and then I'll go ahead and examine the pupillary reflex real fast. Okay, I'm on my small aperture. So for his pupillary reflex, I'm going to have him look straight forward, and then I'm going to shine it into his eyes, and I'm going to observe for constriction. Okay, I can see the constriction. Moving to the other side, I can see the constriction. I'm going to check his consensual response. When I shine it to this side, that eye's going to constrict. Okay, I can see that constriction too. Alright, I can see this. Now I'm going to test the swing flashlight. This is for Marcus Gunn pupil. It's going to basically dilate instead of constrict. I'll check this. Yeah, I see constriction on that side. Alright, I see constriction on this side, and I can see his red reflex. I'm going to go closer to him, medially, so you can see his lens. Okay, and I'm going to go inside his lens to see his blood vessels, and then to his optic disc, his retina, and then look towards the light. I'm going to look at your macula. I'm going to do the same thing for the other side. This time I'm going to use my left hand, my left eye, looking at his left eye. And I'm going to go ahead and look at his lens first. Okay, so looking at your lens, I'm going to go medial. I'm going to look at your blood vessels in the back, leading to your optic disc and your retina. And then looking for any AV nicking, copper wiring, look towards my light. Now I'm going to look at your macula in the back. Inspecting for any tracheal deviation and inspecting for any adenopathy on both sides. I'm going to go ahead and auscultate your carotids right now first. So I use the bell side over here. I'm going to put it on the carotid. This is the sternocleidomastoid, and then you can just breathe as normally. Okay, I'm going to switch sides, and can you face towards me? Alright, and I'm going to go ahead and auscultate his thyroid too. Okay. Now I'll go ahead and palpate his carotids. Palpating his right side first, making sure I don't do it bilaterally. And then can you face me again? Okay, I'm going to palpate this region as well. And then for his trachea and thyroid, I'm going to go in back of him. I'm going to palpate his thyroid right here first. And I'm going to have you swallow. Okay, this is for checking for any hard nodules that I can find. Going middle for his isthmus, and then feeling his trachea right here. And can you swallow again? Okay. Alright. Okay, next what I'll be doing is checking his lymph nodes on the back. So first I'm going to go into his cervical right here, or occipital in the back right here. Okay, just let me know if there's any tenderness.
No.
And then his posterior cervical, his anterior cervical, and then his carotids right here, and then his posterior auricular, and his pre-auricular, and then I'm going to go to his submandibular over here, and then right here is submental. Okay, and then we have to not miss the supraclavicular as well. Alright, I'm going to go ahead and untie your gown for you, and then can you put your down towards the bottom of your chest. Okay, I'm going to go ahead and auscultate his pulses. So I'm going to use the diaphragm first to auscultate his second intercostals first, his aortic valve right there, and then right here is your pulmonic valve. I'm going to go down right here for his tricuspid, and then up here for his mitral. I'm going to switch over to my bell, and I'm going to do the same thing for either sides, and I'm hearing for any S3 or S4 murmurs. Okay, and same thing for his tricuspid, and then his mitral. So I can definitely hear that voice loud and clear. I'm going to go ahead and palpate your PMI, your point of maximum impulse right here, right there, feeling for any pulse and rhythm. Alright, and then can you go ahead and let me know if you feel any tenderness in this region? Okay, I'm looking for any pectus excavator or carinatum that I can find. You can pull your gown back up. And then I'll tie it for you in the back, and then tie it over. And then after this, I'm gonna go ahead and lay you down. So before that, I'll lift the table up to 45 degrees. And this is gonna observe his jugular venous distension. Go ahead and lay down, please. Okay, nice and comfortable. And then just extend your legs up. Okay, this is for any cushion right there. All right, I'm gonna let you face that way, please. I'm observing his JVD distension, jugular venous distension. And go ahead and pull your gown up, please. I'm gonna put the drape up. Okay, I'm gonna lay it over his ASIS. All right, and I'm gonna auscultate his abdominal arteries first. Using my bell side, I'm gonna go ahead and listen for any murmurs that I can feel and can hear. And I'm gonna go to his lateral side, just listening to his renal arteries. Okay? Alright, and then you can pull that gown back down. Good. I'm gonna go ahead and undress your shoes, okay? And this is gonna be for your posterior tibial and anterior tibial. Dorsal pedis. So I'm gonna go ahead and take the socks all the way to around this area right there. And I can basically feel it from here. And then same thing for this side. Okay, right there. Alright, so I'm gonna palpate his posterior tibials on this side and that side. And I feel it really loud right there, very clear. And then his dorsal pedis right there too. Okay, his dorsal pedis. I'll put your socks back on for you. Alright, and then I'm going to go ahead and sanitize my hands first after I touch your socks. And then I'm going to go and palpate your radial pulses, okay? So radial pulses going to be on both sides, so just do that for me. Okay? I'll palpate up here, right there. And then his brachial, down up here. I can do it in the cubital fossa or under his biceps, either way. Alright, and then lastly, I'm going to end off with the Allen's test. So the Allen's test, I'm going to include both the ulnar and radial arteries, grasp your hand, and then release. Okay, and we can see that his palm is white, and I've released, and it becomes red as it perfuses back. Okay, I'm going to check the other side. Go ahead and grasp your hand, and then release. And I'm going to release your radial this time, and it goes back and it perfuses. Okay, alright, thank you very much, Mr. Suresh. I'm completed with my clinical examination. Thank you.
Now, the last portion of this video simply consists of some community activities, such as blood pressure screenings and health fairs that you can attend while you're at Carey, doing your classes on the weekends. A lot of them are actually part of the undergrad, such as the orchestra and the plays. I thought I'd include a little segment on Carey's weather. This was a rare event. It's a snow day that happened, and so school was canceled, and we had a great time.
Yo guys, this is Vince. So I'm at Willem Carey, and then we actually just finished our mock for the OPP. That's the Osteopathic Principles of Practice. And so we prepared for our Tuesday exam, and now today's Saturday. So one of our professors, Dr. Friedlander, he's our professor for histology. He sent out an email saying, does anyone want to ride with him today? Go on an airplane. So he's pretty cool. I'm not really sure if it's his plane, but is this plane? Yep. Yeah, so we're gonna go ahead and fly with him, which is really cool. Both myself, and
I'm Alex. I'm a second-year medical student.
yeah, so we both got the same email, and we just hopped on it. So it's both our first time riding on the plane. Are you kind of excited?
Super excited. Have you ever flown before, Vince?
I've never flown on a small plane actually, so this will be a really cool experience for me as well. Yeah, I've always wanted to do it after I watched that jet movie, you know.
Top Gun.
Top Gun, that's right. Top Gun, yeah.
Overall, this was an amazing experience, especially when I got to see our campus from a plane. Never expected that I'd be doing this, but anyways, it was a great experience and I'd love to do it again.
Alright, we are now at the end of the video. Thank you so much for viewing until this point and for your time. This next segment is what I really want to emphasize. Despite the workload in medical school, you can still have a great time. Keep going. You got this.
Yay. In summary, your experiences at Carey as a undergrad student or medical student is really based on what you make of it. If you put in the work, if you become a go-getter, make sure that you seek out every opportunity possible, then you'll have a great time. Connect with a group that you really like, that's got your back, and just keep going. Keep pushing, and don't look back.